can you explain what is fatty liver and what are the symptoms so
Okay.
that people can get to know they have fatty liver?
Okay. Fatty liver is like the term signifies fatty liver. Fat deposition in the liver. So somebody will ask, is it normal or it is abnormal?
Yeah.
You have your body composition. You have muscles, bones, and fat. Somebody in the body outer composition, you have less fat. Somebody is more fat. So we
Yeah.
classify fat, obese, super obese in that category medically. In same proportion, fat gets deposited in the liver. So what I told earlier, liver, whenever you take a diet, carbohydrate, protein, fat, they get segregated in the intestine and they go to the liver. Liver distributes them in different ways chemically. And when, I will only discuss about the fat part, whenever there is excess of fat, like calories in terms, and those fat don't get utilized by the body organs, that liver decides. When there is excess, so those fats get stored in the liver. Once those are stored in the different cells, slowly they grow. You are taking diet, you are on excess diet, you are not utilizing, you are not doing exercise, you are not utilizing the same way your input, your output is not there. Where it will go? So it gets slowly deposited in the liver. Over months and years, those are detected in the ultrasound as fatty liver. Grade 1, grade 2, 90, you will find 95% of the populations you do ultrasound in general. If they are adults group, like body weight 60 kilos or 65, 70 kilos, invariably everybody has fatty liver. This was not there 10 years back because of the lifestyle. Everybody is eating good, but not in the way they are doing work, physical work. So where that will go? That is stored in the liver. So with time, so it is not a disease. You get to know that fat is deposited. Like fat is deposited in your body, you get to know it is bad or it is good, but it is bad for long term. In the same way, how the fat is bad for heart and other organs, we have this problem. Same way, the slowly, it is like a oil. Fat is like a oil in the liver. Once over the period of months and years, those fatty livers, this oil causes burning of the liver tissue. What we called as NASH, N-A-S-H, that is called as hepatitis, means inflammation of the liver. So initial stage is fatty liver, nothing, you don't have disease, it is just a condition. But you should get to aware that if this continues over the years, then it will lead to damage of the liver. Then once your hepatitis starts, means damage of the liver, there will be indigestion, bloating. In general, problem will start. You will not get to know. You will think it is acidity. You will think it is related to food. Then after 5 years, when that damage persists, then liver cirrhosis or damage happens. And we are seeing nowadays it is common because of the westernization of the food, because of the change of the lifestyle, because of the urbanization, because of everything. That's why it is common nowadays. These things are coming up.
So these are the reasons for fatty liver, like mainly our lifestyle and eating habits. There is any other major cause for fatty liver?
Fatty liver, I will say it is like 80% and 90% are people oriented. Their diet, their lifestyle. 10% is genetic. 10% genetic in the sense means like whatever small they eat, they will gain weight. It is like genetic predisposition that they gain weight very early. Those are very few people. You just get to that those things. 90% of the patients, whatever people they have fatty liver, is because of excess diet. Whenever somebody gastric patient comes, if you ultrasound shows fatty liver, it will give a roadmap, clear map about the patient having. I don't need to inquire. If I just ask them about how many non-veg, how many fried items, how many times you take outside food, it will just invariably it will be clear that they will be taking overeating. So people don't know actually. It is not their fault that they are eating more. What is the quality of food is important. Even if you are a vegetarian, you are on a different diets, you can have fatty liver. It is not that only non-veg or fried items cause that. The fundamental thing you have to understand, people think fatty liver. Oh, if I take excess fat, I will have fatty liver. No. If you take excess of carbs, like sugars. Forget about sugars. If you take excessive rice, cereals, chapati, dosa, idli, whatever, all those are
Okay, that we
starch,
call healthy
carbohydrates.
food.
If you take our excess in the liver,
Okay.
that gets stored as fat. Carbohydrates get converted to fat. It is actually the innate mechanism of the liver is to store those things for emergency.
Yes.
It is for emergency, like if you don't eat food, those are utilized. That's why if you do
Yes.
fasting, you lose weight, na. But
Yeah.
you are not affected. Those
Yes.
fat gets burned up by the liver. So liver, in the sense, it is like balancer. If you load it, it gets overloaded. Then it's called fatty liver.
Okay. Okay,
So
sir.
even if vegetarian people, those are like Jain people, they also have fatty liver because they only eat carbohydrates. So balanced diet is very important.
Yeah, means balance is important, like
Yeah.
how much you are eating and how much you are exercising in physical activity.
Everything is interrelated. It is not that okay, I will do dieting, I will eat not this that, I will have remove the fatty liver. The way fatty liver starts, like it takes months and years to deposit fat. In the same way, it takes months to clear away fat.
Yes,
So
exactly.
when I counsel my patients, it takes half an hour. It is like mental willingness. It is more of a willingness of a person to
Yeah, correct.
get to those kind of things. It is like awareness. You take care of your body. What
Yes,
you eat, what you not eat, you just choose. It is simple.